You're listening to Newsdrive with Andrew Black. Now, if you've read today's Daily Record newspaper, you'll have seen its front page has been given over to a powerful editorial calling for the decriminalisation of drugs. It comes just days before the publication of figures showing how many people died in Scotland last year from drug-related causes. They are widely expected to show, for the first time, the death toll at more than 1,000. Well, our Home Affairs correspondent, Reevel Alderson, joins me now. Reevel, is this an unusual stance by a national newspaper?
Well, I think it is. It's a very strong stance, and I think this sort of editorialisation and the call behind it for decriminalisation of drugs, I'm pretty sure that's the first time that's happened in Scotland. But it does follow a number of investigations by the Daily Record and others, of course, into the effects of drugs legislation as we have it at the moment. And bear in mind, this is a call for decriminalisation, not legalisation, and there's a significant difference. But basically, there's a growing demand at the moment for the so-called war on drugs to be ended as a failure, and for society's approach to deal with drug addiction as a health issue rather than as a criminal justice measure.
Surely that's been the approach of the Scottish Government for some years now.
Well, it has, and it's been so since the publication of the SNP government's first drug strategy. That was in 2008. It was called The Road to Recovery. It focused, naturally enough, on recovery, but also looked at prevention, at treatment, rehabilitation, education, enforcement, of course, and the protection of children. So the user was put at the heart of the programme, and the programme's been subsequently refreshed last year. The user was there rather than dealers and organised crime. But, of course, it is important to tackle illegality, and that continues with drug seizures that we read about day and daily. But the complaint, I think, of the SNP government is that drugs legislation is reserved to Westminster with the Misuse of Drugs Act 1971. And at Westminster, the Tory government has no truck whatsoever with what might be perceived as a softy approach to illegal drugs. And as an example of this, you can witness Holyrood ministers will say that the Home Office's refusal to allow Scotland's senior prosecutor, the Lord Advocate, to have some latitude in dealing with drug possession in what's been termed as a fixed room in Glasgow, where users would be able to take their own illegal drugs under medical supervision. That's a proposal designed to cut deaths among street drug users, but the Home Office has set its face firmly against that.
Is that a fair complaint, do you think?
Well, it's a complaint echoed at Westminster's Scottish Affairs Committee. Now, this is a committee of the Commons, which, of course, has a majority of SNP members, but it's currently investigating problem drug use in Scotland. But their investigation and the complaint of the Holyrood government about these consumption rooms in Glasgow has been described to me by one senior figure in drugs policy as a smokescreen. The SNP blames Westminster. Westminster controls the Misuse of Drugs Act 1971, and that outlines what drugs and what activities are illegal. But the committee did hear evidence from 2 English police forces who are allowing officers to give warnings to users found with a small amount of drugs in their possession, rather than charging them and potentially giving them criminal records. And that tactic is used in Scotland in terms of cannabis possession. If you had a small amount of cannabis, which you could clearly demonstrate that was for personal use, then you would be given a recorded warning, as it's called. But there's no reason why it couldn't be used for personal amounts of heroin or cocaine found on a person, even though these are strictly against the Misuse of Drugs Act. And just going back to the fixed rooms, it may not even be particularly effective to have them, because of all of the deaths for drugs in Scotland in 2017, around only 10 were amongst street drug users in Glasgow. So it might have saved their lives, but that was out of a total of 934 national deaths.
And the Scottish Government refreshed its drug strategy last year, and as you were saying, very much a focus on recovery and rehabilitation. Has it had any effect, though?
Well, it's a bit early to say. I think it was November of last year that they launched this revamped strategy. It does treat drug use as a public health concern. The government said support, not stigmatisation of users, was important, but drugs charities authorities rather say that these are fine words which aren't necessarily translated into action. What's needed, they say, are better quality services, same-day prescription of opiate replacements such as methadone rather than having to wait. And I've also heard from drug workers who say that the emphasis on the old strategy for users to achieve abstinence, give up drugs completely, is misplaced, because it meant that high levels of methadone prescription were seen as bad, lower levels were seen as better, users often given smaller daily doses than perhaps they needed. They then topped that up with street heroin. And that's where the quality of service is key. Individuals need to be treated individually. But I'll tell you what, this is a very, very complex subject. If I had the answer, I would have told somebody by now, and I'm afraid when we get the drugs figures in on the 16th of June, they will be over 1,000. There will be a lot of soul searching, but do we have the answers yet? I'm afraid no, we don't, Andrew.
Okay, thank you very much, Reevel. That's our Home Affairs correspondent, Reevel Alderson.